win. Unless it's via.
Atzlachel, Ceab, Danelle Reed Seatsta. Good day, honorable people. I am Danelle Reed. I'm a member of the Puyallup tribe, and I am director of Kawachi Counseling Center. I come here to speak to you today on the state of mental health services for our people and in support of the bill. KCC is the designated Indian Health Service facility responsible for providing the culturally competent outpatient services for the roughly 15,000 Native American tribal people living in Pierce County. We receive base funding from Indian Health Service, through the federal treaty obligations set forth in the Medicine Creek Treaty. This is equal to less than 17% of our operational budget. Native Americans score the highest on ACEs, which are adverse childhood experiences, which leads to higher rates of depression, suicide attempts, chronic disease, and generally poorer life outcomes. This bears out in our population. Native Americans disproportionately suffer from, and they have the highest rates of suicide mortality, depression, anxiety, and other serious mental health conditions. 14% of our adult population have co-occurring disorders. Suicide is the 8th leading cause of death in our adults. Suicide is the 2nd leading cause of death in our young people and our young adults. Homelessness rates are the highest among all ethnic minority groups. Our school dropout rates are highest in the nation. College acceptance and graduation rates are the lowest. Historical and intergenerational trauma has been found to be real, and researchers cite this is due to the pervasive and destructive history of U.S. federal policies aimed to do away with the Indian problem. We are a AAAHC accredited clinic and have been continuously licensed as a mental health agency with the state for more than 30 years. In spite of this, we have not had a contract with the county to provide mental health services since 2010. This means the county does not fund any services to our Native American community. Consequently, they are not providing the essential services needed to meet the mental health needs of Native Americans. KCC needs the mental health system to step up and care about mental health needs of Native Americans in this county. One of our greatest challenges we face is barriers to accessing higher levels of care, especially for our youth. We recently had to send out a child, 11 years old, out of state in order to receive stabilization services because there were no beds available. We have had a county crisis worker tell our client, your suicide plan is not good enough. We won't take you. His plan was to drive his car into an oncoming semi. We see a lack of understanding and cultural competence within the county system. We experience a lack of respect and acknowledgement that our tribal system has highly qualified professionals who know our clients best, and yet we cannot get our clients into the crisis system. We often pray for our clients when we have to trust the county to keep them safe. This should not be our reality. I also would like to add that the proposed committee should absolutely include a representative from the tribe. I appreciate your time today, and I hope that you will do the compassionate thing, do the right thing in support of our most vulnerable in our community, and vote yes on the 1%. Hawadoobs Chalep, Hoyafchut. I am finished.